But speaking of emergencies, since we're seeing a lot of it, I had a patient who, this may be your case too. I know is an anxious time when your child was on the schedule to get a cavity filled, and then we had to abruptly close our offices. I know most dental offices across the nation closed on around the week of March 17th. And I'm sure there's a huge concern for parents out there what to do if this cavity starts to grow bigger, how can they prevent it from growing bigger, and what to do if it causes pain. And there's also some cases of maybe some old fillings that were going to get repaired, or perhaps the kiddo bit on something and pulled out something sticky or tacky, that pulled off their crown or their filling, and now they have this hole. And so I thought it'd be a good idea maybe to go over a temporary filling material that you can get at Walgreens or CVS or where Rite Aid pharmacy that is in your area. I took it out because I'm going to show you, but it's Temparin from Dentek is one that I grabbed. That one of my patients, we walked through it on the phone, and they did a great job. So I wanted to show you just a picture of how the tooth presented when the parents called. They said that he was on the schedule to get this cavity filled. You see the hole in his baby molar. Now remember, those baby molars, they stay in until they're between the ages of 10 and 12. And so when they get bigger, actually I have a little model here to show you. So here's one tooth model. When the cavity first starts, now the decay starts through the enamel and then goes down into the dentin. And that's when we want to get it filled before it starts to grow and get bigger. As it grows, then we see the brown part being the decay, getting closer to the pulp. The pulp contains the nerve and the blood vessels. And of course, if decay gets in there, that's when the nerve gets infected and dies and causes pain. And you need to do a root canal, or if worst case scenario, an extraction. And that happens at this point. Do you see how now the nerves are exposed, the blood vessels, the decay has gotten really, really deep like that. So luckily that cavity is not to that point, but when you have a big hole in the tooth like this, then of course food and plaque, debris is gonna get stuck in there. And that causes the tooth to be sensitive. Drinking cold water can cause it some sensitivity because the nerve is exposed. So by putting a temporary material on, that will, one, help prevent stuff from getting stuck in there. And then also, the material has eugenol, which I'm going to explain a little bit later, but eugenol is a liquidy oil that's extracted from essential oil, mainly clove oil, and is used in the dental materials that we use every day for temporaries, for root canal sealings, for just things to kind of as an anesthetic to help relieve pain. So, are you ready for a tutorial? This will be fun. I haven't done this. Okay, so learning new things as we're learning to adapt in this new world. All right, and I'll try to show you as best as I can. And also, I'm going to try to have some questions going, promise to answer questions at the end. So let's see. So here's a little model of the tooth. And you see the hole there. When you get this material out of this little container, it comes with the container with the paste inside and a little instrument that looks like this. So this end, we call this spade. This is what you're going to kind of section off the amount of material you need. And then a little ball that's going to help you to condense it in, or push it in the hole like that. But I'm also going to give you a dental pro tip that only you're going to get here, is that just taking a cotton tip or a Q-tip, but wet it with water so it's damp. It's going to help push it in and set it up. Okay, so I'm excited here. Okay, so what is inside the container is just a paste. And I on the eugenol, they mix it with zinc oxide. Zinc oxide we use for sunscreen. So the zinc oxide and the eugenol is mixed, and it makes the paste. And then you're just going to slice off an amount. It's okay if you get too much, but just kind of gauge on how big your hole is, because you're going to want to make it filled over, a little overfilling it into the cavity. After you get that, then, and actually even this much I would think is probably even too much. So I'm going to just take a little bit off, just pinching it off. Then you're just gonna roll it. So just roly-poly in your fingers. Of course, wash your hands before you do this. Now, for the kids, make sure you brush their teeth first to get out any food debris, crackers, chips, anything like those refined carbs that we talked a lot about last week, and it's saved on our Mommy Dentist page and also on Instagram. That those break down and they get stuck in there and they stay in there longer. So make sure you get that cleaned out so you get a nice clean finish. It doesn't have to be very dry in the mouth. A little moisture is okay. And then we're gonna put it in the hole with your finger and just opening big. Of course, is way easier with a model in my hand than a little squirmy kid moving around. But you're just gonna look, I'm just squish it with my finger. You can use the ball end of the instrument that was provided and you just squish, 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 squish. But what I like the wet cotton tip for here, it actually really just gets it in there. It contours it to the grooves of the tooth. And if you have any excess, you can, oh, I'm so sorry, I'm trying my best to show you. You can like just take it off like that, see? And so we're just gonna slide that off. Just one, it's too hard, I'm gonna do it right. And Then if it's smaller, I'm gonna take my ball and just kind of go in there. Now, what's gonna make it easier too with the kiddos is after you have that in the hole, in the finger, you can have them bite down. Just have them bite on it, and by biting on it, let me bring over my other model. When they bite on it, they'll bite it into place and it'll take the contours of the cusps and squish it in to their normal bite. So it's still kind of soft and malleable. Just have them bite down. They can kind of chew, grind back and forth. And then you can go back in and see if there's like too much again, just go in with the little instrument and just clean off any excess. Okay, so I'm gonna show you here how it looks. All right, just like that. And the parent was nice enough to take a picture for me. We were doing teledentistry, which just know your dental office has an after hours triage number to do some teledentistry with you as well. Okay, so here was before. And then I'm going to try to get in a little bit closer. And that's how it looked in his mouth afterwards. Make it bigger. Does it help? Doo-doo-doo. And I was so relieved to hear they called and said he did great afterwards. The pain went away. He finally had a good night's rest. Now, of course, if a cavity is causing so much pain, the dentist will most likely have you come in. We would see you and see what's going on if there's like an infection, an abscess that develops on the cheek. So we're just trying to suggest something that you can use, that you can purchase over the counter if you're having slight sensitivity, food and stuff is getting stuck in the cavity, and just one tool you can do to try to help minimize the growth of the decay until our offices are reopened.